Hello and welcome to Straight Talk. I'm Stephanie Domerat. Now, the Oregon Health and Science University has been a powerhouse of research and innovation here in Oregon for decades. It's one of the state's largest employers and is a leader in areas like cancer research through the Knight Institute. However, OHSU has faced its share of challenges over the last year with financial struggles, capacity issues, and layoffs. Today, we're joined by the university's president, Dr. Shereef Elnahal. Dr. Elnahal was appointed to lead OHSU in June of this year and assumed the position in August. Before joining OHSU, he served as the Undersecretary of Health at the Department of Veterans Affairs, appointed by former President Joe Biden. Before his time at the VA, Dr. Elnahal served as president of University Hospital in Newark, New Jersey. Shereef, thank you so much for being here today. We appreciate it.
Yeah, thanks for having me, Stephanie.
And welcome to Portland also.
Thank you.
Well, I want to begin with news that's making headlines this week after President Trump endorsed claims of a link between use of Tylenol during pregnancy and autism. Here's some of what he had to say.
Acetaminophen, which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism.
Now, OHSU has a leading autism research center. So what does the data from your researchers show about this connection? And of course, acetaminophen is Tylenol.
Well, first thing I'll say, Stephanie, is thank you for having me on. And, autism affects so many families here in Oregon and across the country. So these are really important questions. I'm not a personal expert on that kind of scientific question, but what I can tell you is that our research center was just the recipient of a large grant from the NIH to investigate the causes of autism, but also what works best in helping families get their kids to better outcomes in autism. And this is part of a large package of grants that the Secretary of Health has offered academic health centers like OHSU across the country. So what I can tell you is that we have the scientists to help answer these questions, and I think we'll be able to help Oregonians across the state.
Has there been any research to make this connection under OHSU's work?
I know that we've had our research center looking into these questions, and there have been some historical studies that have shown an association, others don't, and claim that it's not real. I'd rather defer that question to the experts and just say that we're here to be able to answer these questions and really work on behalf of Oregonians dealing with this.
Of course, you also have a women's health center. You have many OBGYNs providing care for pregnant patients in Oregon and in the area. So what is your guidance to them right now under this news and these headlines this week?
Well, OHSU always takes a leadership role in communicating these kinds of risks to families across Oregon. And so people can feel free to access our website. I know the governor is asking us to look into this more and is collaborating with all of the western states, California, the state of Washington, on recommendations like this. And so just stay tuned for the recommendations from our experts, our scientists, as we move forward on this.
When it comes to if a pregnant patient has a fever, though, is it still recommended that it is more safe for them to take Tylenol in that instance, or where does that land as far as your guidance for those under the care of OHSU doctors?
Yeah, our understanding is that that recommendation still stands, that a moderate dose of acetaminophen is safe. But again, these are questions that are always evolving with the science. And so this is a clear signal to us to look into that question more. And again, we're really excited about that new grant from the NIH that's really looking into what leads to the best outcomes for children with autism after that diagnosis. We want them to have the best experience and the best outcomes throughout their whole life.
So let's talk about the budget deficit facing OHSU. The last fiscal year ended with a sizable loss, and that was with layoffs as well in 2024, meant to stabilize the budget. Do you anticipate additional layoffs at this time?
We're really hoping to avoid that, Stephanie, and that's why I really tried to come in front of the entire workforce in a town hall just a couple of weeks ago, explaining where we are in the budget. We had a really significant loss last year, and what we need to do as a team to get out of that. And so we're engaging in a really comprehensive strategic plan, getting input from folks across our organization. And I was really heartened to get many emails from frontline workers, electricians, nurses, food service workers with ideas on how to save money and increase efficiency and really just increase the value and quality of what we do for patients.
So at University Hospital in New Jersey, where we mentioned you used to work, you led a financial turnaround after years of operating losses there. What do you hope to bring from your experience there that could help in this situation here at OHSU?
Well, the first thing I did there is I visited every unit of the hospital myself to try to build trust. And so OHSU is a very large organization. It's going to take some time to do that. But I've tried to get in front of folks with multiple venues, town halls, virtual engagements, and going to where the work is happening, because I know the best ideas come from the people doing the work at OHSU. And so that's going to be my first task in helping us get out of this financial issue. And I just want to remind folks that we excel on our scientific mission, our research mission, and yes, our clinical care mission. And when we get our finances together, we'll be able to invest even more in our workforce and our infrastructure to make that happen even better for Oregonians and folks across the country who get our care.
Hospitals across Oregon are running at or over capacity, and Oregon remains actually among the lowest states for staffed hospital beds per capita. So this means patients end up waiting hours, even days to be seen. They're seen in hallways. How big of an issue is this at OHSU, and what can be done to improve this?
It's a really important issue that we're facing, Stephanie. I visited the emergency room myself. I had a chance to meet our excellent clinicians, our physicians, nurses, and I saw those patients boarded in the hallway. And if anybody, our staff really does not want to have to do that. We are planning for an emergency room expansion. That project's going to take another 12 to 18 months. But once that expansion happens, we hope to alleviate some of that. And of course, we're also opening a new building entirely, the Vista Pavilion, that's going to be dedicated to patients with cancer. That is also going to free up capacity in the form of beds across our entire campus, both on Markham Hill and on the waterfront. And so we're really, really happy that that's happening. It's going to take some time, but we hope to get better outcomes there.
So earlier this year, OHS leaders did speak about this capacity issue. It's an issue that we're seeing a lot of. And one of the things they said is because patients are arriving sicker and they're staying longer. Is this a trend that we're seeing not only here in Oregon, but nationally as well?
It is a trend. We're seeing the need for folks to stay, not just for their clinical issues, but also waiting for that next step in their care, whether it's a nursing home or a skilled nursing facility. We're seeing capacity issues across the continuum of care. And so OHSU is going to be a big player in helping to solve those problems. But again, I know the governor and our colleagues across the state and the provider community are going to work together to try to build that capacity over time.
What are some of the things that can be done around that?
I think the sheer number of beds and our workforce are the most important ingredients, the most important assets we have. And so we have an initiative called 30-30-30 that the legislature asked us to do to increase the total healthcare workforce, to increase the diversity of the workforce, and to make sure that we have the healthcare workforce of the future. And so we have incredible professional schools like our School of Nursing, our School of Public Health, that'll offer these professionals to folks across the state, and we're really excited about that.
Why do you think, as I mentioned, some of the OHS leaders in the past have said people are sicker. Why do you think that's happening right now?
So the overall population is getting older, and with age, of course, comes cancer diagnoses, chronic disease like heart disease. And so with that phenomenon, the need for complex care goes up. And we're often the only source of certain types of care because we're an academic health center. We play that very unique role. And so really there's no other solution than for us to build that kind of capacity to be there for Oregonians no matter what they need in terms of their care.
So earlier this year, the proposed OHSU Legacy merger was terminated in May. This was, of course, before you were on board. In the end, though, OHSU and Legacy made a public joint statement saying they were better off serving the community individually. Can you talk more about the reasoning behind this and what it means now going forward for OHSU?
Well, the first thing I'll say is that I appreciate very much our current relationship with Legacy. We collaborate with them on cancer care and other kinds of care with partnerships that already exist. And so I do think there was a good case for that merger in the past. But of course, because healthcare costs are escalating for every health system across the country, the financial situation did get worse for both institutions. And so that was the main reason the merger didn't happen. But I do hope we can get even more partnerships going with them and our other provider colleagues across the state to just better serve an accessible system for Oregonians.
So the House passed Trump's big, beautiful bill earlier this year, which made changes to Medicaid requirements and benefits. Now, most of these changes we'll see happen later next year. But how will these changes impact OHSU's patients?
We're really concerned about what the potential effects are. We're working closely with the state and with the governor on planning for that. She's been really forward-leaning on gathering us together to come up with a plan. We anticipate up to 150 to 200,000 people rolling off of Medicaid. That's a big issue when it comes to healthcare access because, of course, we have to be there for people's emergency needs when they have to go to the emergency room or get an emergency procedure, for example. But if we're not able to give them that longitudinal care, that primary care, that preventative care, all we're going to see is health outcomes get worse while people's access is worse because they've lost coverage. So we're getting together to figure out what to do next to be able to offer that care sustainably. And it's going to be a hard set of issues to solve, but I'm confident with the governor's focus on this that we'll be able to get through it.
Are you working with other institutions or hospitals across the state regarding this, especially when it comes to, access to healthcare for people who live in rural areas?
Well, we are, and so, I'm already meeting with our colleagues across the state, again, convened by the governor's office to really try and solve this problem. We see some really concerning projections on the ability to finance healthcare across the state because of H.R. 1. And so it's really going to require us to band together to come up with creative solutions and figure out a way to get through this. And I think we will.
Let's talk about research, which is a big part of OHSU's mission. So earlier this year, the NIH paused or canceled many research grants, including ones at OHSU. You did mention that you recently did receive a new grant from NIH, but where do your research projects stand on that funding? Especially, I know the flu vaccine is a big part of what OHSU does every year.
Yeah. So Stephanie, we get up to $600 million a year from the NIH for research. It is the most important funder for research across the country, including for us right here at OHSU. And so we were concerned when the president's budget came out earlier this year that could be significantly lower investment in research here. But we're encouraged by what we're seeing by Congress. So Congress, both chambers, have released a draft bill that actually maintains or even slightly increases funding for NIH. And I have the utmost confidence that our scientists will continue to be competitive for those grants. And so my concern level on this is a little bit lower now that Congress did that. And our research, Stephanie, is game changing. We do research across the spectrum from basic science all the way to clinical research that it ends up just being a part of the care that folks get when they come to OHSU.
So right now the disruptions are minimal for this.
We've seen some grants canceled. We've seen some funding for our education mission canceled, and that's been hard to go through. But overall, we've seen, again, folks winning grants every single week. We get the news out about the exciting research happening, and so far that's continuing.
We only have about a minute left, but OHSU's National Primate Research Center has faced intense scrutiny, especially over this last year. Oregon's governor even called for it to close. They cited unethical testing on these animals and that it was unnecessary and dated at this point. Where do you stand on this issue?
Well, I heard and read a lot about this issue, Stephanie, as you might imagine, before coming in. And so I had a chance to actually visit the Primate Center last week. And what I can tell you is the staff there do their very best to care for these animals. The science itself is interesting. Some of it, I think, is really going to be impactful for humans. Just like we are looking across our entire research mission for what the NIH is going to do, I think the NIH has signaled that they may be moving away from primate research in terms of what they're funding. And so we don't know what that picture is going to look like yet. We'll watch it very closely. We're going to have to be very responsive to what the NIH decides to do on this.
I really appreciate your time today. Welcome to Portland again, and thank you for coming in.
Thanks so much, Stephanie.
Thank you. And coming up after the break, we will be joined by U.S. Representative Maxine Dexter. We'll be right back.